Hello everyone, my name is Jean Yashkevich and today I'm going to discuss my first artifact for this course. The topic will be around preparing new oncology nursing staff for telehealth practice. Of course, the presentation will focus more on the background, but also on teaching and learning. So let's start with my objectives. So for my objectives of this presentation, I want to explore the role and value of telehealth in oncology nursing practice. I do want to examine the current standards of practice for telehealth in oncology, examine the impact of COVID-19. I want to look at effective strategies to address training and learning in telehealth practice in oncology, and also to discuss the implications in oncology nursing practice. So before we go any further, I do want to define telehealth first. I think we just need a background information on telehealth. So telehealth, according to World Health Organization, it is the use of telecommunications and virtual technology to deliver healthcare outside of the traditional healthcare facilities like in the hospitals. It is sometimes called telenursing, telemedicine, virtual care, mHealth, and more. So it is really anything that is not face-to-face. It includes use of email, phone, instant messaging, audio or video conferences. So a brief impact of COVID-19. So because of social distancing and quarantine requirements to reduce the transmission of COVID-19, it has led to the rapid and widespread adoption of telehealth. So it's never been, like it's this fast. It was adopted quite fast because of the COVID-19 requirements and the risk for transmission. So telehealth, because our topic is focusing more on telehealth and oncology practice, let's look at the background information about telehealth in oncology. So telehealth in cancer care is not new. We've used it effectively in cancer symptom management, survivorship care, providing remote chemotherapy supervision, palliative care, and psychological support. So for cancer symptom management in Canada, oncology nurses use the Pan-Canadian Oncology Symptom Triage and Remote Support, or COSTARS practice guidelines. So that guideline, or a guide, it enhances symptom support by nurses to patients undergoing cancer treatment. For survivorship care, conducting surveillance follow-up like virtual visits. And then we also do remote chemotherapy supervision, such as oral chemotherapy's compliance and management of side effects. Palliative care, access to nursing support, nursing and physician support, and also access to social workers for counseling support. So that's under the psychological support. So we've been using telehealth in cancer care. In fact, in our organization, we had a pilot program around using telehealth, or the Ontario Telemedicine Network, for prostate cancer patients on oral treatment. So we've had that since 2017, and we still have those patients who are using the OTN, or Ontario Telemedicine Network, where they can, these are led by pharmacists and nursing, and it's virtual. So we've had that for a while. It's just not utilized this big and this large scale. So before we can discuss the teaching and learning, let's review first the practice standards and competencies, because there is an updated practice standards and competencies. So first, because I live in Ontario, I'm practicing in Ontario, and I'm a nurse. So the College of Nurses of Ontario Telepractice Guideline defines nursing telepractice as the delivery, management, and coordination of care and services provided via information and telecommunication technologies. Like I said, it includes the use of a phone, email, video and audio conferencing, instant messaging, teleradiology, and telerobotics. It outlines 6 different principles. So these are the principles. But for the purpose of this presentation, I do want to focus more on the third principle, roles and responsibilities and competency. It kind of works hand in hand. So under roles and responsibilities, according to the CNO, a nurse is accountable for recognizing whether he has the knowledge, skill, and judgment to meet the needs of the patient. A nurse providing care using information and telecommunication technologies is accountable for consulting with the appropriate healthcare professional and, when necessary, to seek advice, information, or assistance, transfer aspects of care, and or transfer of care. Now, in my practice as an oncology clinic nurse, my role is with a new model of care since the pandemic. I'm half virtual and half in person. And on my virtual days, I do get phone calls from patients. For example, a patient on immunotherapy calling about a new onset shortness of breath. Now, after going through the co-stars, those decision tools that I'm going to go about later on, I'll give you information about that. But going through that questionnaire, as an oncology nurse with a knowledge, expertise, and skill, I know that immunotherapy can cause like a side effect of pneumonitis or a lung inflammation, or this new onset shortness of breath could be COVID, or this could be even PE or pulmonary embolism. So you have to use, you need to have that knowledge, skill, and judgment in order to practice safe care, right? So that's a great example of that, and that goes along with Principle 6 too, competency. So according to the CNO, some nursing telepractice requires competence, expertise, and knowledge beyond that what is obtained in a basic nursing program. So the basic nursing program don't really teach you anything about immunotherapy. But in this case, you'll need to be taking extra courses like the foundations of oncology, which most new hires have to take after a few months of being hired. So they need, and then also the chemo course. So those are like recommendation that new hires must complete when they get hired in oncology, because those are the only way you can really get the information or education from or knowledge, aside from training, of course, and practice. So nurses providing telepractice care must possess current and in-depth knowledge in the clinical areas relevant to the role. Oncology especially is ever-changing. There's always new treatments coming up, a lot of education, and you have to be really updated of those knowledge. But your organization where you work will provide training and in-services of any of those new treatments, so you won't be alone. It's just that you need to be keeping up with the new knowledge around treatments. Nurses are also expected to assess their competence at using technology, identify knowledge gaps, and seek training or education to close any of those identified gaps. And then competence and effectiveness in telepractice nursing may be enhanced through a focused formal education program or an adequate orientation. So yes. Next standard of nursing telepractice would be from Cancer Care Ontario. Again, from Ontario, this could be BC Cancer Agency if you're located in BC, but for the purpose, because I live in Ontario, I'm going to talk about the Cancer Care Ontario Oncology Nursing Telepractice Standards. So it's defined as a component of telemedicine where nurses use information and communication systems to deliver, manage, and coordinate care and services to meet the health needs of patients and families. This is adopted from the College of Nurses of Ontario definition, and this includes the education, counseling, and answering questions related to diagnostics, lab testing, and results, disease-specific and treatment-related inquiries, and linking patients and families to resources. Teletriage to assess and collect a caller's symptoms and evaluate the urgency of a health problem. That's a big thing. That is a big part of my role as an oncology clinic nurse. There's a lot of triaging involved, and really problem solving and having that knowledge and nursing judgment and critical thinking skills to evaluate the urgency of that health problem. And then it includes provision of symptom management and psychosocial support, including self-management support to promote self-care, and then evaluation of understanding of information or advice. So this piece is this is what it looks like, the framework from Cancer Care Ontario. So it has, in that framework, in this framework actually, I'm going to focus more on the oncology nursing expertise in this presentation. So oncology nursing expertise and experience. According to CCO, or Cancer Care Ontario's telepractice standard, only registered nurses should be utilized for patient-initiated calls, where the purpose of the call is teletriage to screen and assess a caller's symptoms and evaluate the urgency of a health problem. When telepractice is a dedicated role of the oncology nurse when there is access to other oncology providers, an RN with Canadian Nursing Association certification in oncology or CONC and greater than or equal to 2 years of experience in oncology is recommended. But when telepractice is a dedicated role of the oncology nurse with limited or no access to other oncology providers, an RN with the CONC certification in oncology and greater than or equal to 2 years of experience is recommended, but it is preferred to have greater than or equal to 5 years of experience. All registered nurses providing telepractice support should obtain the Canadian Nursing Association certification in oncology as a nationally recognized nursing specialty credential by their 5th year of practice. That's their recommendation. But now I'm gonna then talk about the implications in oncology nursing practice. So why am I talking about telehealth, and what's the teaching and learning focus that I want to talk about in this presentation? So this is really the big issue, the nursing shortage. So over the past 20 years, there has been a lot of focus on the nursing shortage, both like nationally, internationally, so globally. In 2007, Canada experienced a shortage of nearly 11,000 full-time nurses. And according to the Canadian Nurse Association, and this was in 2012, this publication, by 2022, so by next year, Canada would be short 60,000 full-time RNs if no action was taken to mitigate the shortfall. I wonder what those numbers are like currently, and also what the shortage is since the pandemic. So that would be interesting to see, but I couldn't find any numbers around the more recent ones. So just knowing that we will be, during 2012, they've estimated that we're going to be short 60,000 full-time RNs by next year. So let's see. This is exactly why I do want to talk about telehealth and what the recommendations are. So recommendations, I've included 3 recommendations so far for this presentation. So first one is to incorporate telehealth practice in undergraduate nursing curriculum. The implementation of nurse residency or transition support program for new graduate nurses, and the implementation of the learning pathway for specialized oncology nurses. Let's focus on the first recommendation. So telehealth practice in undergraduate curriculum. So healthcare students have limited exposure to telehealth technologies prior to graduation. So I don't think I've ever had any training about telehealth in my undergrad years. But the demand for qualified health professionals with competencies in the use of telehealth is expected to rise, especially since the pandemic. Therefore, curriculum development in undergraduate and postgraduate healthcare professional accredited courses should include telehealth competencies. So the new model of care that we have in my organization, where I work, we've had this plan to utilize telehealth before pandemic. And since its rapid adoption because of COVID-19, the plan is to keep pretty much a telehealth practice, the virtual care model. So we're keeping the new model of care, especially the telehealth piece. Therefore, it's not going to go away. It's going to continue to be a part of our role as oncology clinic nurses. Therefore, we need to incorporate this in competency, like this skill, from the very beginning in undergraduate curriculum. In fact, a study was done in my research where they may not have the skills. The undergraduate nursing students may not have the necessary skills, but what you learn in the undergraduate curriculum is communication skills. It'll improve your communication, and it'll give you an experience of what it's like to do telehealth practice. So that comes with experience, but if you can get it started in the undergraduate curriculum, learning the telehealth, learning the communication skills, and the etiquette of conducting telehealth practice. So it has to be learned by experience. But if you get it started early on in the career, like adding in the undergraduate curriculum, it'll be better. It would be helpful. And then oncology nurse residency. So a lot of the like globally, US, Australia, Canada included, like I am a product, like I started my career, I graduated, after I graduated in 2011, I was one of the fortunate ones who was able to use the new graduate initiative program for nurses. So that was very helpful to really improve your confidence and competency, to get you really comfortable and prepared. So oncology, incorporating an oncology nurse residency program. So according to Honey and Wright, there has been a debate around the level of nursing practice required to participate in telehealth. I can understand why. Some believe that it is not an area for new graduate nurses. The global consensus is like wherever, in Australia, in the US or Canada, in Europe, telehealth is more suited to experienced nurses, but with a nursing shortage and limited number of specialized oncology nurses, it is really becoming more critical to implement telehealth education early in the nursing career. So that's the global consensus. Though, with the nursing shortage, we find that I would provide recommendations later on as to what we can do to help novice nurses to have support to get them ready for the outpatient, the telehealth role. So this is the learning pathway for specialized oncology nurses, and this is available. Let me just get it closely here. So this is the example of the learning pathway for new staff in ambulatory oncology. This is an example from Juravinski Cancer Center in Hamilton here in Ontario. So this is what it looks like to the pathway for specialized oncology nurses. And in my role as a clinic nurse, the first 4 week really is a general orientation, but in the clinic nursing role, it includes a review of telephone triage tool and dictation. So there's more learning pathway available in the Canadian Association of Nurses in Oncology website under the Education and Events tab for, just pick a specialized area. It could be inpatient or hematology. Though their specific standards and competencies are in place, due to the nursing shortage, cancer centers have to make a decision to recruit new graduate nurses and their staff with no prior oncology experience. So this is really helpful as a pathway for those type, for that situation. And then in this pathway, we're utilizing Patricia Benner's From Novice to Expert theory. The theory really presents a systematic way of understanding how a learner, whether a student, new or seasoned nurse, develops skills and understanding of a practice, situation, event, or event over time. It has different 5 stages of proficiency: novice, advanced, beginner, competent, proficient, and expert. And Patricia Benner's conceptual framework reflects on the practice of the utilization of the learning pathway, which I just showed you, for nurses in their journey in becoming a specialized oncology nurse. So I thought I have to add Patricia Benner's theory there. But from here on, from this slide and onwards, let's now focus the topic on teaching and learning piece. So what are the effective educational learning tools and activities to prepare novice oncology nurses in telepractice? Because this is why I chose this topic, is to really find out, identify, or examine effective educational learning tools and activities for a novice oncology nurse in telepractice specifically. First educational learning tool or activity is the use of the decision support tools. Now, there's that global consensus that oncology, those who are practicing telehealth should have, more, those are reserved for experienced nurses. But what if we can provide those decision support tools to guide, to help novice nurses in their decision making, right? So let's look at, this is the list of decision support tools. The first 2 are very common ones: the Pan-Canadian Oncology Symptom Triage and Remote Support Practice Guideline, and the Cancer Care and Care Symptom Management Guides. Now there's different guides for, it could be the BC Cancer Agency one, but the co-stars is within Canada. So decision support tools help guide the assessment, disposition and advice provided to the caller, who is the patient. It serves to provide a checklist to ensure the important elements are not overlooked during the assessment. This does not replace the critical thinking skills or your clinical nursing judgment, but these are really helpful tools I find for novice oncology nurses. Like when I started in oncology, even though I have a background in surgical oncology, the clinic area is a bit different. It's a lot different. There's different things to remember, there's a lot of knowledge gap still, but these tools are quite helpful when you're making that, for the decision making, helpful in your assessment. Like you can start with this too, and then you can learn from those experiences. But if you follow this too, it will serve you well in oncology. So next one is, let's look at an example. So figure 3 is the co-stars questionnaire. So both the questionnaire, both the co-stars and the symptom guide, these are embedded in our electronic health record system. We're using Cerner, but this is embedded in a lot of other electronic health system from what I know. These are the type of questions that is assessed. So there's like various questions. It looks lengthy, but the idea is so you don't miss any of your assessment, and then you can make a very concise and systematic way of doing your assessment. And then coupled with adding the management guide that is consistent and is also evidence-based. So with this two alone, you can ensure that your practice is consistent with what is based on evidence and what we're supposed to tell our patients. So, this is making everything consistent for us oncology nurses. And then, so the co-stars, again, primarily used for telenursing and oncology practice. I do use this sometimes for in-person, but this is mainly used, this was created for telenursing and oncology. It has 17 practice guides for nurses to aid us in conducting telenursing to patients on cancer treatments. And the CCO symptom guideline provides nurses and patients information on how to manage specific symptoms related to the cancer or cancer treatment. So we actually provide this specific pamphlet to our patients before they begin their treatment. So when we do receive a call from them, I often grab the pamphlet, and then I ask the patients to grab their own copy, and then we'll go through the exact page as to what they should do. That way it's more, when we're doing teaching, it's a visual, auditory, and then they have a teach back strategy as well, which you can do when you're teaching or orientating a new staff. So that you can do the same thing, like the way you teach patients, you can do the same thing for the new staff in oncology. It makes it a lot easy to understand. And then simulation-based learning. So another activity that is quite helpful and quite effective everywhere you go is a simulation-based learning. It is an effective learning strategy to enhance student engagement, construct knowledge, skills, and experience. It allows students to engage in a learning experience that is based on real-life experiences. So we do a lot of simulation-based learning in undergrad years, right? Now, I don't have any experience about the virtual sim lab component, but the only virtual that we're doing right now, a simulation-based, is when we're teaching, when we're doing the orientation for, the training for the use of electronic health record system. So that has switched to virtual, like I think most organizations are doing. We do have a mock or a training system that they use that looks the same as the main system. So that's what we're doing, like a virtual simulation only for that piece. But most of our training, specifically in the clinic, because of our model of change, or half virtual, is based on role play. So role play allows students to explore realistic situations by interacting with other students in order to develop experience and trial different strategies in a supported environment. So by role play as well, we can identify what is that new hire, what that new nurse is going to do based on the information presented to them. the information that we receive usually, like, from a phone call is not always with all the information. So we have to, based from, with the role play, they will have an idea as to what an experienced nurse will do in that situation, right? And what their process, their thinking process as well. So let's now talk about the teaching philosophies or perspectives based on the activities I provided. So the first one is progressive perspective. So a progressive perspective really emphasizes an experiential problem-solving approach to learning. The purpose of learning is to equip learners with practical knowledge and problem-solving skills. And then, so role play and simulation really both use the problem-solving methods based on real situations or experiences. Reflections garnered from both activities promote new learning. Thus equates to the application of new learning in real-life situations. So there's a lot of learning that can happen with both activities, and it belongs really in the progressive perspective or progressive philosophy of teaching. And then we have the experiential learning. So experiential learning is also known as hands-on learning. It's a second foundational element of andragogy, which is a method and practice of teaching adult learners, or in adult education. So that is the definition of it. And learners immerse in activities and then reflect on their experiences. This is like my favorite type of learning. Simulation draws from Kolb's experiential learning cycle, where the learning during the start of the simulation encounters a new experience and then reflect, and then the learner will then reflect on that experience. After reflection, it gives rise to a new idea or a modification in our practice. The learner will then apply the new learning in real life settings. So whether it's simulation or role play, if the learner is practicing, and then the facilitator will then tells the learner that, you can also do it this way, and the rationality of why we're doing that modification in practice. So after further reflection, it does give rise to a new idea or a modification in our practice. That way we can apply it in real life settings, right? Then in conclusion, the COVID-19 pandemic brought rapid adoption of telehealth oncology in healthcare. Telehealth has been utilized in oncology, but never been in this scale, where face-to-face visits were now replaced for the most part by virtual visits due to social distancing and quarantine guidelines. With a global nursing shortage as well, recommendations made to incorporate telehealth in undergraduate curriculum to mitigate this issue. Another recommendation was to implement a nurse residency program in the ambulatory oncology unit. Lastly is to incorporate the learning pathway for the specialized oncology nurse. In addition, effective tools and learning strategies such as the use of decision support tool, role play, and simulation needed to be utilized to improve readiness of new oncology nurses, not just the readiness though, but competency as well in telehealth in oncology practice. So again, this is pretty much my presentation. This is the end of it. This is the references, 2 pages of references, and that's pretty much the end of my presentation. Thank you so much for listening and for staying, with me and for this long. But if you do have any questions, you can send me an email, or you can, see me in class, and I can try to answer those questions. Thank you so much. Take care. Bye.